Hi everyone, my name is Donna and I'm currently a second year student here at CU Denver. I'm a public health major on the pre-med track and I'm here today to talk a little bit about the health professions program that's offered here at CU Denver. And I'll be talking a little bit about getting started and preparing for a health career. So basically just like the surface of pre-health and pre-med careers. Nothing about graduate school because that's very overwhelming and that's another presentation if you're interested in that. But I'll just talk about what incoming freshman college students should be expecting, what you should be doing, and also just what the general outcome would look like. So, first up is the personal prep. And one of the first questions you should ask yourself is, am I ready to go down this track? The pre-health slash pre-med track is very time consuming. You're going to go through at least 6 to 10 years of education through college and medical school. So you have to ask yourself if you're ready to go through that much more schooling, more education, more learning, more memorization, and everything like that. It's also a lot of money. So, of course, school is not cheap, and you have to pay for all these classes in medical school. And of course, there's a lot of financial factors that can be assist with it, financial aid and everything, but it's still going to be very expensive. So you have to consider that when you're interested in entering this career. And then for more information on cost and time and what school you want to go to, I recommend reaching out to a health advisor, which I'll talk a little bit more about later. And then another question that you should consider is, do you like to learn? Again, you're going to go through at least 6 to 10 years of education. So if you don't like to learn, I wouldn't consider this career just because going through the pre-med, pre-health career, you should be interested in learning just for the sake of learning, just being curious and things like that. That's one of the more common characteristics of people that go down pre-med, pre-health. That, of course, doesn't mean you'd have to have this characteristic, but it's very helpful. And if you don't like to learn, it's not a great career to go down because you're going to be learning new things every day and seeing new things every day. Another question is human service important to you? And this is important because a lot of people consider going into the pre-med, pre-health career say, solely just for the income, and that's not a great factor because again it's really expensive. And if you're interested in just making a high income, there's definitely other careers that you can make a high income as well, but also have shorter training and education. So that's a thing to put in mind. And then lastly, have you made an informed, mature decision to pursue a career in the health profession? It's a very long career, but in the end, it's very worthy of. It's a really fulfilling career to be able to help people and to be able to say that you're able to help people with your own hands. That's a really fulfilling career, and it's also not a career for everyone. So you have to take all these considerations into fact. Yeah, so that is the personal prep. And then we move on to a couple of notes, and these are just some like general confusion I've seen pre-med students and pre-health students have gone through when first entering college, and some things that I've also gotten a little confused about. So just some little clarification is one of the things that a lot of pre-med pre-health students consider and are in fear of are the time frame. So a lot of people consider the 4-year time frame like the ideal time frame. You have to go through a strict schedule, go through all these factors and go through them all the same time and through like a strict checklist. This is definitely not the path for everyone. In fact, it's not even the path for the majority. And as you can see here, only around 33% of first-time applicants apply their 4th year for matriculation or application to professional school right after graduation. So what that means is a lot of students don't use 4 years. They take more time to finish their education in college before applying to medical school. So they'll take like an extra year or maybe a couple semesters. So they might take a gap year, or they might take an opportunity to go study abroad, which is highly recommended. And you should definitely do that because that will reduce the risk of burnout, which is definitely very prevalent with pre-med and pre-health students. It'll be especially prevalent during medical school. So during college, you should really take advantage of this time to really expand your learning opportunities, expand your mind and your thinking capabilities and everything like that. So again, taking additional semesters in time is normal and it's definitely healthy. A lot of students that apply right after 4 years, many of them don't get in. Again, the application for medical school is very competitive. So there's not a lot of people who get accepted, or maybe over 50% of people who get rejected. Not to scare you, but that's just the reality of it. So it's important to take your time to make sure you make the most of your learning opportunity during college, and so that you perform to the best of your capability. So again, don't rush the process. That's one of the biggest advice I got from my bio professor, which is take your time, because this career, it's very, again, time consuming, but you have to be able to learn, to be able to adapt and everything like that. So don't rush the process. And then to continue with the notes, a misconception with major is a lot of students think you have to major in a science or biology based degree, and that's not true. Medical schools actually don't care what your degree is. What matters is how well you get your degree and how well you perform in required prerequisite science courses. What that means is a lot of medical schools consider your GPA and your performances based on different factors. And one of those factors is just your science courses. So that's going to be your science courses combined with your math courses. So basically, all your STEM courses combined in one. You should definitely focus on performing very well in these science courses, because that's a really big factor in applications for medical school. And then thirdly is experience. Experience is probably one of the really important factors in application as well. Experience is critical, and with more time you get more teachings and learn more, which makes sense because you're going to experience more things, you're going to see more, and you're going to learn more with more time. So also you should stay up to date with medicine and what is going on in the world. Be educated in the technical, professional aspects, social and political aspects of healthcare. One of the important factors of being a healthcare provider is staying up to date with the world. You have to stay informed of what's happening in order to give the most to your community, because if you don't know what's happening in your community, you can't really give to your community. Yeah, and so with that, I will move on to basically you should be doing during your first year and of going into CU Denver. So there's a pre-health checklist. You can find the checklist document on the CU Denver Health Professions Program page, along with many more tips and documents from staff and faculty on that page. So during your freshman year, this is when you should meet with your pre-health advisor as soon as you can, and you can learn your requirements needed for the major that you decide in, and they can help you with the track you need to go down for pre-med and pre-health. This is also when you should think about your major and minor. If you haven't already, you should really consider that early in order to fulfill all the requirements you need for your major. And this is also when you map out your 4-year plan or whatever plan you desire. And it definitely seems early, but it's definitely important to plan early in order so you can have more knowledge of what you're going to do in the future. So currently for the advising team, there's only 3 for the summer of 2020 right now, and these are the 3 people on the screen right here. You can screenshot or take a picture of it. So they only operate by appointment only, and they'll be operating through Zoom. So they'll have virtual conferences with you over video, and you can either email them on the emails listed on the screen or call the office directly. And then also with academics and extracurricular during your first year, you are just transitioning into college, which is a very big step. So focus on transitioning into college. Develop your study skills and adjust to the college life. Know what works for you. And also, CU Denver offers FYE, FYS, and also just other resources that will help you learn about your learning style and how you best study and retain information. So I definitely take advantage of those opportunities and resources at CU Denver. Also join clubs. There are many health career related clubs at CU Denver. I'm currently on the board of MAPS, which is the Minority Association of Pre-Health Students. So definitely take advantage of those clubs. They can help assist you, and they'll also bring a lot of connections that you can make. And also keep up with the world. Stay on top of what is happening. Read stuff. Definitely read news articles and things. And also maintain a good GPA. Now, having a B or a C doesn't stop cancel your opportunity to go to medical school. What's important is keeping a pattern. So as long as medical schools see you're keeping a relatively good pattern of keeping a good grade, not having like B's and C's every semester, but only like once this semester and every so often, that means you're going to maintain a good GPA. And an excellent GPA is a 3.75. And then the courses you should be looking at taking during your first year, if you haven't taken already, is Gen Bio 1 with lab, Gen Chem 1 with lab, and also algebra. And then on to the spring semester. The spring semester, you should meet with your advisor again. You should meet with your health advisor and also your academic advisor, all your advisors at least once a semester. But it definitely doesn't do any harm if you decide to meet with them more times a semester. It will help you just better situate yourself. Also, this is the time where you should begin community service related activities and work/volunteer in a medical setting. So one of the most important advice that I've gotten from my pre-health advisor is having service, but also developing your why. So when you're doing service and volunteering, you should have meaning, and it should all pertain to your why, which is your why of why you want to go do a medical career. And if you're volunteering and you're interning and things like that are not pertaining to your why, then you're really only volunteering just for the sake of putting hours down, which is definitely not effective, and it's not going to make you a better person. So it should definitely have meaning towards your why and why you want to go into medicine, why you want to help people. And then also for the courses, it's basically a continuation of what you were taking during your first semester. So Gen Bio 2 with lab, Gen Chem 2 with lab, and also trigonometry. So those are the courses. And then for the programs offered at CU Denver, there is a BA, BS, MD, or DDS program, so or known as BABS here at CU Denver. The goal of this program is to aim to promote the diversity of medical professionals practicing medicine in Colorado. It has a very tedious checklist and eligibility. You have to apply before you or when you get accepted to CU Denver. So if you are interested in this program, reach out to Trisha Vasquez, which is the director of the program. She's also one of the pre-health advisors. She's one of my health advisors. She's definitely very helpful if you're interested in looking at this program. And then that's the pre-health checklist for basically your first year. So to go through that, and you also can find the checklist again on the pre-health website. And then for what's next, basically just stay in contact with your advisor. They will give you a reality check on whether you are doing a good job or not necessarily a good job, but if you are performing well and what your chances are in getting into getting medical school. And then also gain experience and make connections. You're gonna need letters of recommendation. You're gonna have to write papers, and just gaining experience and making connections. One makes your college experience much better, knowing that you have people to lean on, but also it gives you a good chance of just having these connections and people who know you. And also keep defining and strengthening your purpose. Again, what I mentioned was the why of why you're going into medicine. And also keep in mind, health careers are not limited to just doctors and nurses. There's countless of careers to help the world in. And also ask for help. It's a big and scary career, and it's such a time consuming career that it's easy to think that you're all alone, but ask for help. There's so many resources here at CU Denver. Ask your professors. They all care about your education and everything. So definitely ask for help and know that you're not alone. And then here's some health areas of interest that are listed on the pre-health website. A lot of people think that health careers are only limited to doctors or nurses, but that's definitely not the case. As you can see from all these categories here, if you decide that pre-med or pre-health is not your direction, there's so many other directions to go down. And you may also be interested in things that are not listed here, such as topics of nutrition, genetic counseling, health education. There's so many different topics. So definitely don't think that being a doctor or being a nurse is the only thing that's associated with pre-med or pre-health. And yeah, so that would be the end of the presentation. For any questions, I would definitely recommend reaching out to your health advisor.